So my name is Mei Krishnasamy. I'm the Chair in Cancer Nursing at the University of Melbourne and Research and Education Lead for Cancer Nursing across the Victorian Comprehensive Cancer Centre in Australia. So the symptom self-management piece is part of a study that comes from a larger randomised controlled trial where we're looking at the benefits of exercise for people who have inoperable lung cancer. And we know internationally that there is robust evidence that shows that exercise helps improve quality of life, reduce symptoms that people experience. But the problem for people with lung cancer, because they experience complex symptoms such as pain, breathlessness and fatigue, is that it's really hard for them to stick to and adhere to an exercise regime. And so the symptom self-management piece is a new intervention that we're trialling where a very experienced cancer nurse proactively calls out to patients and helps, if you like, nip in the bud problems or symptoms that one might be distressing people in and of themselves. But in the context of the randomised trial, maybe preventing those people who are in the intervention arm from being able to adhere to their exercise. So the study's in its infancy, but really the opportunity is understanding how in an environment globally where we're looking to move care from acute centres such as hospitals out into the community, how do we then set up proactive, safe, high quality services that allow people to be cared for in their home? And traditionally what we've been doing is we send people out to shared care with GPs, but there's very little proactive engagement out from the specialist cancer centres to support people, particularly people who have rare and less common cancers, but also people like lung cancer patients who unfortunately still have a very poor prognosis, of setting up and testing studies and new models where we know patients like them, they work for them and they're safe. And so the implications of this study are that it offers us a better understanding of how we can move to some of these models of care safely and well for people. So my perspective is I bring an Australian perspective from the Cancer Nursing Society of Australia, but the opportunity in that talk tomorrow will be to bring nurse leaders from across America as well as EONS Australia to think about how do we harness the potential of cancer nurses. We are, as nurses more broadly, the largest global health workforce anywhere in the world, and the opportunity around the national societies is giving expert nurses a voice, an advocacy voice for patients and families, but also for the profession more broadly, and really in an environment across the world where the emphasis is on cost containment and cutting costs. Senior experienced nurses are often first in line, and so I think what the national organisations do is it allows us to really garner our strength, garner our message, and help people understand that experienced cancer nurses not only make care safer and better for patients, we actually make care cheaper. And so national organisations allow a unified voice. They allow us to think about how do we build the next generation of cancer nurses around education and research. But critically, the main intent is how do we continue to always push for the best advocacy for patient care. Well, I think the programme itself speaks to the theme of the conference really strongly. So addressing healthcare needs, trying to balance the healthcare needs of people in a changing context. And that's not just within a cancer context, but people that we know who are already disadvantaged by their social situation before they even start their cancer treatment. And what we'll see today and we'll see more of tomorrow are nurses talking about how they, on that day-to-day basis, through their one-in-one interactions with people, are able to address what are alarming concerns around the inequity in how we ensure people have access to care. And so there are some real highlights around survivorship models. Thankfully, more and more people are living longer after a cancer diagnosis, but that brings pressure to the system. And there are certainly a series of talks around how do we develop meaningful survivorship models of care. There are really important questions around how do we ensure access to remarkable new drugs that are coming onto the market and make sure that those are not just available to the people who can afford them or can have access to them. So a number of highlights that really speak to the theme of the conference and will really showcase how nurses across Europe are addressing the needs of cancer patients.